Okay, let's jump right in. There's some pretty significant news we need to cover today.
Yeah, the reports about former President Joe Biden.
Exactly. He's 82, and he's been diagnosed with aggressive prostate cancer.
And it's not just localized, which is the key thing here.
Right. It's metastasized. That means it's spread to his bones specifically.
Which puts it at stage 4. The diagnosis came after, a few weeks of urinary symptoms?
Yeah. And then they found a nodule on his prostate.
So, confirming the details we have, aggressive cancer, it's spread to the bone that's metastatic, and a Gleason score of 9 out of 10.
We'll definitely need to unpack what that Gleason score means. It sounds high.
It is. It indicates a high level of aggressiveness, and we know he's reviewing treatment options now with his family and doctors.
He also put out a public statement expressing gratitude, and he said something quite moving. Cancer touches us all. We are strongest in the broken places.
That really resonates, doesn't it? Hits home for a lot of people.
It does. So for this deep dive, what we want to do is really understand the medical side of this diagnosis, what it might mean for him, and, put it in the bigger picture of men's health, the conversation around cancer.
Makes sense. A lot to cover there.
Okay, so let's start with the basics. Medically speaking, what exactly is the prostate? Why is it such a focus, especially for older men?
Right. So the prostate, it's a small gland, think walnut-sized roughly.
Okay.
It sits in men just below the bladder, and it actually surrounds the urethra, that's the tube carrying urine out.
Ah, okay. And its function?
Its main job is producing fluid that becomes part of semen. As men get older, the prostate can have issues. Benign enlargement is super common.
Right, BPH.
Exactly. But also cancer, like in this case.
So prostate cancer itself is happening on a cellular level.
It's basically uncontrolled cell growth in the prostate gland. Cells start growing abnormally, multiplying when they shouldn't.
And it's pretty common, right?
Very common. Second most common cancer in men globally. But, and this is really important, most prostate cancers are actually slow growing. They stay confined to the prostate.
So detected early.
Exactly. If found early, many men live for years and often die with it from something else, not from it.
But President Biden's diagnosis uses the words aggressive and metastatic. What's the difference we need to understand there?
Good question. Aggressive refers to the cancer's behavior. It grows faster. It's more likely to spread.
Okay.
Metastatic means it has already spread. It's moved beyond the prostate. In his case, as we said, to the bangs.
And that spread is what makes it stage 4.
Precisely. Stage 4 or advanced cancer.
Okay, let's talk about that Gleason score. It was 9 out of 10. How does that scoring work? What does a 9 tell us?
The Gleason score is a really critical grading system. Pathologists look at the cancer cells under a microscope.
Right.
They assess how abnormal they look compared to normal prostate cells. The more abnormal, the higher the score, and the more aggressive the cancer is likely to be.
So what's the range?
It runs from 6 to 10. A score of 6 is, least aggressive. Cells look pretty close to normal, slow growth.
Okay.
A 7 is intermediate. Might grow and spread a bit more readily, but often still very manageable.
And then the higher scores.
Right. 8, 9, and 10, those mean aggressive cancer. The cells look very different. They multiply fast, much more likely to spread.
So a 9, like President Biden's score.
Yeah, a 9 means the cells are highly abnormal. It points to a fast-growing, very aggressive cancer.
Got it. The reports also mentioned his cancer is hormone sensitive. What's the significance of that for treatment?
That's actually a really important piece of information. Hormone sensitive means the tumor needs male hormones, mainly testosterone, to grow.
Like fuel for the fire.
Exactly. So if you can reduce the testosterone levels in the body or block its effect on the cancer cells,
you can slow the cancer down.
You can often slow it down or even shrink the tumors, at least for a while. It means the cancer is likely to respond well initially to hormone therapy. That's also called androgen deprivation therapy, or ADT.
Okay, so let's recap the medical picture here. It's metastatic, spread to the bone, Gleason 9, very aggressive, but crucially, hormone sensitive.
That sums it up well. It gives a clearer idea of the challenge, but also a potential therapeutic angle with hormone therapy.
So moving on from the diagnosis itself.
Yeah.
Metastatic prostate cancer. What does that mean for prognosis these days? It sounds quite serious.
It is serious, no doubt. And historically, the outlook was pretty grim, but things have changed quite a bit, especially in the last decade or so.
How so?
Medical advancements. Now, it's often described as treatable, but not curable.
Treatable, not curable. Okay.
Experts in the field, like Dr. Matthew Smith at Mass General, they often say men can live several years now, maybe 4 to 5 years, sometimes longer, if they respond well to the therapies.
That's definitely better than it used to be.
And Dr. Herbert Lepore at NYU Langone, he's suggested even longer, maybe 5-10 years or more for many, because the treatments have just gotten that much better.
That's a significant improvement. What are these treatments that have made such a difference?
Well, given the hormone sensitivity, hormone therapy, ADT, is likely front and center. That involves lowering testosterone, using medications, or sometimes surgery.
Yeah.
Then there's chemotherapy. That's usually considered if or when hormone therapy stops working as well. Chemo kills rapidly dividing cells.
Right.
We also have newer approaches, targeted therapies that go after specific molecules on the cancer cells, and immunotherapy, which helps boost the body's own immune system to fight the cancer.
And what about the fact that it's spread to the bones? Are there specific treatments for that?
Yes, absolutely. That's a major focus. There are bone-targeting agents, drugs like bisphosphonates or denosumab. They help strengthen the bones, reduce pain, lower the risk of fractures.
Important for quality of life, I imagine.
Hugely. Radiation therapy can also be used, often for symptom control, especially targeting painful bone spots. And of course, clinical trials are always an option, testing new cutting-edge therapies.
With all these options, though, there must be side effects to consider, especially for someone who's 82.
Oh, definitely. That's a huge part of the equation. Hormone therapy, for instance, can cause fatigue, hot flashes, loss of libido, bone thinning, even mood changes. Chemo has its own well-known side effects: fatigue, nausea, hair loss, risk of infection. Targeted therapies and immunotherapies can also have side effects, sometimes quite specific ones.
So it's a balancing act.
It's a critical balancing act, weighing the aggressiveness of the treatment against the impact on quality of life. That conversation is central, especially for older patients. You want to manage the disease, but also maintain function and well-being.
Makes sense. Now, this news obviously generated a lot of reaction. What did we see publicly and politically?
The reaction was pretty widespread and actually quite unifying in many respects.
Oh, so?
We saw statements from across the political aisle. Former President Trump wished him a fast and successful recovery.
Despite their history.
Right. Vice President Kamala Harris called him a fighter, expressed confidence. Former President Obama pointed to Biden's long work on cancer research, also voiced support.
So a sense of shared concern.
Yeah, a real bipartisan wave of support and empathy. It kind of underscores how cancer impacts everyone, regardless of politics.
It really does.
Yeah.
And President Biden's own connection to cancer is so deep with the Cancer Moonshot Initiative.
Absolutely. Driven by losing his son Beau to brain cancer in 2015. That initiative was already personal as VP and president.
This diagnosis must add another layer entirely.
No doubt. It brings the fight he's championed through the moonshot right to his own doorstep, underscoring the urgency of the research and treatments he's advocated for.
Let's pivot a bit to men's health and screening. There were reports, I think, that President Biden didn't have prostate cancer screening at his last physical in February 2024. That sparked some debate, right?
It did. It raised questions among some medical observers. Was this a missed opportunity for potentially earlier detection?
But it's not straightforward, is it? The screening guidelines.
Not at all. It's actually a really complex area. Screening usually involves a PSA blood test, sometimes a digital rectal exam. Whether or not doing it was a missed chance. Well, it highlights the ongoing debate. Screening recommendations vary, and they get particularly nuanced for older men.
So what are the general guidelines people should be aware of?
They do differ. The American Cancer Society, for instance, suggests men talk to their doctor about screening starting at age 50 if they're average risk.
And higher risk.
Higher risk, like Black men or men with a close relative diagnosed young, they suggest starting that conversation earlier, maybe 45 or even 40 if there's a strong family history.
Okay. And other groups?
The U.S. Preventive Services Task Force, they recommend a more individualized decision for men aged 55 to 69. Basically, talk to your doctor, weigh the pros and cons for you personally.
And for men over 70.
Generally, the USPSTF does not recommend routine screening for most men over 70. The thinking is that many prostate cancers found at that age are slow-growing and might not actually cause harm during their lifetime. Diagnosing and treating them could cause more problems than the cancer itself.
So it really is a conversation to have with your doctor.
Absolutely. There's no single right answer. It depends on individual risk, health status, and personal values.
And President Biden's case being so public, it definitely pushes these issues, screening, men's health, aging, even medical transparency for leaders right into the spotlight.
For sure. When a figure like him gets this diagnosis, it elevates the whole conversation. It might encourage more men to actually have that screening talk with their doctors, which could be a positive outcome.
Thinking about the bigger picture, the historical context, a president or former president facing a major health issue. It's not unprecedented.
Not at all. Presidential health has always been a point of public fascination, sometimes secrecy. Think FDR's polio and wheelchair use, mostly hidden, or JFK's Addison's disease. But today, there's generally, I'd say, an expectation of more transparency. President Biden's diagnosis, even post-presidency, kind of fits that trend.
And it sparks those debates again, privacy versus public knowledge, fitness, age.
Exactly. Though it's interesting, as we noted, how the initial response seems largely unified, empathetic, even in today's often combative media world.
So looking forward, what's next for Joe Biden personally, and what are the takeaways for the rest of us?
For him, the immediate step is clearly working with his doctors, deciding on the best treatment path. That's going to involve balancing longevity, the stage of the cancer, his age, and crucially, quality of life.
And ongoing monitoring, I assume.
Definitely. Frequent follow-ups, imaging scans, blood tests like PSA to track how the cancer's responding. Treatments might need adjusting based on effectiveness and how well he's tolerating the side effects.
His journey being so public could be quite impactful.
It could be. A powerful narrative, potentially, about facing cancer, the importance of research, treatment access, resilience. It humanizes the experience for many.
And are there broader trends related to prostate cancer we should be aware of?
There are. The American Cancer Society actually expects a rise in new cases, projecting around, I think, 313,000 for 2025. There's been about a 3% annual increase in cases since 2014.
Wow, that's significant. Why the increase?
It's likely multifactorial changes in screening practices might play a role, possibly environmental factors, aging population. It's complex.
And survival rates.
Overall, the 5-year survival for all stages of prostate cancer combined is very high, around 97%. But, and this is key for metastatic disease when it has spread distantly, like to the bones, the 5-year survival rate drops significantly, down to about 37%.
That really underscores the seriousness of a metastatic diagnosis.
It does. Though, again, that hormone sensitivity is a positive initial factor. Those treatments can work well for a time.
But resistance can develop.
Yes, that's a common challenge. The cancer can eventually figure out how to grow even with low testosterone. That's when other treatments like chemo or newer agents become necessary.
And this all circles back to the cancer moonshot, doesn't it?
It really does. It highlights the urgency of that initiative. And there are concerns, about federal research funding. Some Senate reports mentioned potential cuts recently, which could slow down progress just when we need it most.
So Biden's diagnosis really touches on medicine, politics, health policy, research.
It sits right at that intersection.
Yeah.
A very significant moment on many levels.
Absolutely. It's a lot to process. The news is significant. The layers are complex. And that quote from President Biden, "Cancer touches us all," it just feels very true right now.
It really does. It's a moment, perhaps, to check in with people we know, offer support to those going through treatment, reflect on our own health, too.
Definitely. And for our listeners, especially men over 50, maybe use this as a prompt. Have that conversation with your doctor about prostate cancer screening. Figure out what makes sense for you.
Yeah, being informed and proactive is so important. Talk to your provider.
So as we wrap up this deep dive, maybe here's something to think about. We know prostate cancer cases are rising. We know screening guidelines have these nuances. So how can you as an individual best engage with your doctor to make really informed choices about early detection and your own health journey, particularly around men's health?
That's a great question to leave people with. Definitely food for thought.